So, today we're going to break down a framework that really gets to the heart of a huge question in healthcare. How do we make sure we're seeing the whole person and not just their diagnosis? We're diving deep into the Holistic Rehabilitation Needs Assessment, or HRNA, and we'll be using the official NICE guidelines to see how it puts a person right at the center of their own recovery journey. Okay, let's start with a really simple question. When someone needs rehabilitation, where do you even begin? I mean, it's a super complex journey. If you only focus on one symptom, let's say trouble walking, you might completely miss the anxiety that's stopping them from even leaving the house, or the sheer fatigue that makes any exercise feel totally impossible. A narrow approach like that, well, it just doesn't work. It misses the big picture. And that right there is exactly why the HRNA was created. It's all about a massive shift in thinking, moving away from just looking at a diagnosis and toward a much more human, much more complete way of providing care. So what is it really? Well, the NICE guideline defines it perfectly. It's an assessment that focuses on the person as a whole and not just their condition or injury. What that actually means is it combines all the necessary clinical stuff with real, meaningful conversations about what matters to that specific person. It's not just about what's wrong, it's about figuring out where they want to go. And this comparison just lays it all out, plain and simple. The old way? It's reactive. You see a problem, you try to fix that one thing. But this person-centered approach, it's completely proactive. It looks at the whole person, their life, their goals, their relationships. It even takes into account social and environmental stuff, like does their home have a bunch of stairs? Do they have a good support system? It's really a night and day difference, moving from just treating a condition to truly supporting a life. Now you can probably guess, an assessment this deep and this comprehensive, well, it's not a one-person job. It absolutely takes a team. So let's dig into who needs to be in the room. The way it gets started is actually pretty clear and collaborative. Once someone identifies the need for it, the first move is to get everyone who's involved on the same page. And then, and this is so important, they all agree on a single lead practitioner. Think of this person as the quarterback, the main point of contact who makes sure all the different pieces of the puzzle fit together perfectly for the person and their family. And would you look at this team? It's broad for a very good reason. You've got your clinical experts, of course, health, mental health, social care, but look at who's right there at the top of the list. The person. They're at the absolute center of everything. And right with them, their family, their carers, the people who know them best. They are all formally part of the process from day one. It's a true partnership. Okay, so we've got the why and we've got the who. Now let's get into the what. What does this assessment actually cover? This is where we really start to map out the whole person. You know, this quote from the guideline itself just says it all. The whole thing doesn't start with a checklist or a form. It starts with a conversation. It's about creating a safe space for someone to just talk, to share their story in their own words. That's the foundation for everything else. And building on that conversation, the assessment really explores a person's entire world. We're talking their background, their work, their hobbies. It looks at the simple activities of daily life. But maybe the most powerful question it asks is, what motivates you? What gets you fired up in the morning? Because understanding that is the key to setting goals that someone will actually want to work towards. Now, alongside that personal side, the clinical assessment is incredibly thorough. I mean, just look at this list. It is designed to cover the whole shebang. Everything from pain and fatigue to emotional health, cognitive function, and communication. This level of detail makes sure that no stone is left unturned, and it helps everyone see how things that might seem separate are actually all connected. And this is such a crucial point. A person's abilities aren't some static thing. Think about it, right? Someone might be doing just fine in the morning, but by the afternoon, they're completely exhausted. They might get around their own home okay, but struggle in a busy, noisy supermarket. The HRNA gets that. It assesses needs in the context of real life, not just in a quiet clinic room. All right, so we've seen what goes into the assessment, but how does it all work in the real world? Let's talk about where the theory hits the road. And it really all starts with this one single powerful number. And that number is 0. This right here might be one of the most important principles in the entire guideline. 0 is the number of days rehabilitation should be delayed while waiting for this big assessment to be finished. The HRNI is a process, not a barrier. If there's an urgent need, you start treatment immediately. The assessment then runs alongside that care, helping to guide and fine-tune it as you go. So all of this information, all these deep conversations, where does it all lead? It leads right here, to setting goals together. The assessment isn't just to fill out a report. It's to empower the person to define their own vision for their future. The goals are focused on what matters to them, they're broken down into small, manageable steps, and they're constantly being reviewed. This makes sure the whole rehab plan stays relevant and completely person-driven. So as we start to wrap this up, the core message of the Holistic Rehabilitation Needs Assessment is just so incredibly clear and powerful. It really is all about putting the person first. When you boil it all down, what it really is a structured roadmap. It's a way to make sure that healthcare professionals see beyond a label or a list of symptoms and truly see the individual standing in front of them, their life, their struggles, and their strengths. And that's the whole point, isn't it? Ultimately, the HRNA ensures that the entire rehabilitation journey is built on a foundation of what is personally meaningful. The goal isn't just to fix a condition, it's to help someone live their life, chase their dreams, and focus on what truly, genuinely matters to them. And that kind of leaves us with a big question to think about. The HRNA gives us this powerful blueprint for neurological care, for sure, but its philosophy is universal. It really challenges all of us to ask, how can we make sure that every single recovery journey, no matter what it's for, begins by seeing the whole person?